Hi everyone. Myself Dr. Chetan Upadhyaya, founder medical director of Praanavaidya. So here we are back with another series of podcasts in which we are inviting eminent allopathic doctors and doctors from other specialties of medicine so that we can have a discussion in their point of view and see how Ayurveda and Western medicine can amalgamate and bring real change in the real medical life. So today in conversation with us we have Dr. Namratha, who has finished her MBBS and then did MS in Obstetrics and Gynecology, and she has completed a fellowship program in laparoscopy from Pune. So she has been practicing gynecology, obstetrics and been a pioneer in the field of infertility and laparoscopy since past 15 years, and she has got a very good name and fame in the city of Bangalore, and she has been practicing for these many years, and it's really a great honor to have here, madam.
Thank you so much for these kind words, Chetan.
So let's get into the topic proper. So Dr. Namratha, you have been in touch with Praanavaidya and you have been seeing me from quite a long time. So what do you feel about this idea and what do you feel about Praanavaidya basically?
So yeah, this is something like out of the box phenomenon what Dr. Chetan has got into, and I appreciate for his efforts and ideas. As we all know, all the patients who come to us don't require the same treatment, right? So everybody has a different body, different mechanism, and they require something, a treatment which suits their body and which gives us result equally. Yes. So when we were talking about integrated medicine or Praanavaidya, so what are we looking at? We are trying to look at something which will help the patient get better in quality of health and give us results as well. So I think how having bath or having food goes hand in hand in a daily life of a individual. I think some kind of Ayurvedic interventions in daily life and allopathic interventions like the lifestyle modifications as well as the treatment which give medically or scientifically takes a very good care of the patient's existing problems, and I think that is what we are aiming at, getting a good result.
Wonderful, wonderful, Dr. Namratha. See, when I started this company, I always had that fear point that how will I be accepted in the allopathy world. So initial days it was a little scary, but I am thankful to doctors like you who really are willing to think out of the box and make sure that your patient gets something good. You are always open for it. So firstly, heartful thanks for being open and trying to get the best for your patients. So that's how we started this whole agenda, and doctors like you are supporting us and making sure that the next world or our future generation is going to get something very good out of medicine called integrated medicine, which is basically amalgamation of everything which is good in that healthcare system. So Dr. Namratha, I want you to speak something about gynecology, obstetrics and infertility, because there is a lot of confusion in the modern society. People think gynecology, or in Kannada herige doctor, so they believe it's only that you go to a doctor just for your problems of or getting delivered. So I want you to put some light on what gynecology can offer much more than delivery.
Yeah, this is a very common statement made to a obstetrician or a gynecologist. You keep on delivering babies, that's how it is, right? So I tell there's much more to it. We don't do only that. So there's much more background work, there's much more things we have to counsel a patient, or nowadays, as you all know, that infertility cases or the incidence of infertility has gone so high that there is a lot of interventions which get required even before a patient gets pregnant. So we do all that. So there is something called, it might be just a minimal tube testing, it might be kind of a sonosalpingogram what we tell, or a 3D ultrasound wherein we pick up a lot of Mullerian anomalies, that is development anomalies wherein the patient wouldn't know her uterus is in this shape at all. So something like that, and where we intervene with laparoscopy and hysteroscopy for the same reason, wherein we see any other left out things, that why the patient is not getting her pregnancy done. And again we have to evaluate the male factor also. So this again has a very integrated approach in our as as a laparoscopic or a obstetrician or a gynecologist. That is one part. The other part is we have so many specialized clinics. So now there is something called as, all of us know that PCOS or PCOD is such a high rise. So we have a PCOD dedicated clinic. We have a high risk pregnancy clinic. Pregnancies as such is not so easy to handle today.
Nowadays.
With such a lifestyle, with such a high age of pregnant mothers, there's always a risk of diabetes, hypertension, epilepsy, everything actually. So it is not just that you be an obstetrician, you need to have some kind of diabetic role, you need to control their BP. So there's so much put into this. And apart from that, we have something called as menopause clinics. So there are a lot of patients who require our help, emotional well-being, social well-being or physical well-being. We do a lot of cancer screenings, that is starting from cervical cancer, which is the most prominent cancer in India. Nowadays it is taken upon with breast cancer. So we see so many cases of breast lumps which might be not diagnosed at a proper time. So this cancer screening is so important. Screening of endometrial cancer, screening of thyroid cancer. So as you know, so many patients of us, they turn into hyperthyroid. That might be a leading cause of their fertility or even pregnancy related issues. So all these things have to be managed in a very well equipped way. It cannot be just get the patient, just do a ANC checkup and deliver. So every step, or even for that matter an anomaly scan, the 5th month scan, what we do is take so much care. We literally spend an hour seeing all the organs, because as such the technology has improved so much and it gives us so much. So we have to give it back to the patients.
Yes. So adding on to the old question, so we know that a lot of gynecologists are majorly concerned about obstetrics and gynecology and medical management, but there are few gynecologists, especially women, who have been hands-on in terms of surgery and open surgeries. Yet there are quite a lot of people, but there are only few people or the gynecologists who are very well versed in laparoscopic surgery. I know in the city of Bangalore you have established your name in keyhole surgeries and laparoscopy. Please let us know more about it so that all my audience can get to know what are the most latest advancement in laparoscopy. Instead of getting a big cut and having the pain and related complication of the cut, if you can get it done in small holes by an expert surgeon like you, we would love to hear from you.
Definitely. So there are many indications for a keyhole surgery. We have operated of around 2.2 kg fibroid. So it was almost around 30 weeks of uterus, 30 weeks of pregnant uterus. We were able to do it with just 4 holes on her abdomen.
Oh.
And the patient was having it since 2 years when she came to us, and it was such a boon to her to get rid of such a huge tumor without any scar on her abdomen. And post-op, it's just so wonderful. It has taken her nowhere. And these are some of the indications where laparoscopy gives us so much of happiness. And we use it in some cases of tubal recanalization, where these are all the niche surgeries wherein it really helps us give lot of success to the patient. So we have patients now losing their kids, or having they want their fertility back after a sterilization operation. So we'll have to join the tubes back, and this is something like a microsurgery, and laparoscopy helps us in doing these surgeries in a way to easier fashion. And doing laparoscopy, it's very difficult for us to go to open surgery, wherein there's so much of tissue handling, there's so much of blood loss. To see that it feels difficult for us because the success rate of our laparoscopy surgery is so high. And we also use laparoscopy in removing a lot of ovarian masses. So we have operated, as you know, there's so much of rise in something called as endometriosis. So endometriosis just eats up the entire pelvis, and it's laparoscopy which gives us such a view wherein we can do tissue by tissue dissection and give a total clearance for an endometriotic patient.
That's amazing. So this has been more of a myth buster, because as the point you told about the tube recanalization, a lot of people outside think once the sterilization is done, their fertility is done.
Correct.
So they only think IVF is the only choice, but majority of them have that stigma.
Correct.
So if a surgeon like you who can do it just with 3 holes, the problem is of course sorted. That's so wonderful to listen from you, Dr. Namratha. So now I feel let's both discuss about what Ayurveda, me speaking about Ayurveda and you speaking about Western medicine in terms of gynecology, how combinedly we can help patients. So to choose a topic, let's start from the present day's king of diseases, I would say. It's infertility, because the majority of Indian population lies in an age group where fertility is almost declining. This is a fact everybody in the country is accepting. So what together can we do? So can you just brief us about what are the major causes of infertility?
First, I would tell our lifestyle. As lifestyle as such is, the habits of smoking, drinking in a very early age. We see kids, college-going students do it on a regular basis. This affects on a long-term fertility, and the obesity, the eating habits, eating a lot of junk food, lot of just fast food at all, not controlling their kind of diet, definitely has a big role in fertility. So as the patient gets obese or their BMI is high, again there either it might be male or female, there is kind of issues with sperm count or sperm motility. Again, there are issues with quality of eggs. And of course, again, with all this, there is high incidence of PCOD. Yeah. PCOD is one of the leading causes of infertility. So
that's been the trending disease everywhere.
I know. So it's and everybody knows it. Nobody. It's like I hardly see any girl nowadays going to college who doesn't know what is PCOS. They come and tell us what is PCOS.
That's the sad part for any doctor to see. So as you rightly pointed out, so if I have to say something about Ayurveda in this point, so we have to understand, but you should say it better, that in terms of Western medicine, for lifestyle disorders, your limitation is you can get into supplements. By your permission, I'm just shouting it loud. So it's all about supplementation. But in the other side of the coin, if you have to speak about Ayurveda is much more than just medicine. We have a lot of focus on lifestyle. So Ayurveda, in our olden ancient textbooks, it has been very clearly written what time do you wake up, how do you spend your day, how do you manage with your season, so that your lifestyle is maintained. If you are maintaining your lifestyle according to Ayurveda, there is no question of infertility, because in Ayurveda, Shukra Dhatu is something which is the reason for your fertility, and that is the last essence of all your lifestyle. So if you are not maintaining your lifestyle, definitely it is understood you are going to suffer from infertility. So if you maintain your lifestyle through Ayurveda, that's a perfect answer for the present day cause what we are talking about. What do you think about it?
Yeah, see, when we counsel a couple or patient for fertility, we always we not only stress on the medications, we tell very clearly, especially girls coming at an earlier age who are at a risk of fertility later, like maybe 5-6 years later in their life, we always tell the root cause of everything is their lifestyle. So even if we give medications, they are always temporary.
Yes.
And the lifestyle, it's known fact. It's not that Ayurveda or allopathy. It's just about lifestyle.
Perfect.
So lifestyle has to be sorted. How we have to be disciplined in our life to come up is the same way our body has to be disciplined to have more healthier life. So I would feel as such, lifestyle should be kind of consciously told to each and every school student and a college student at an educational level. They need not come to a hospital for that. It has to be enrooted in their studies or wherever they have some medical education.
What a thought did you get, Dr. Namratha? This is really an enlightening thought. We should really get this propaganda so that people outside do understand. If this is sown in their brains in a childhood, definitely the future generation can be saved.
And the parents I feel the kids now are really pampered.
Yeah.
You ask them, they have pocket money. You ask them, they get it at the right time. They just don't even think. So I think somewhere the parents' role is very important. They have to tell, this is the right thing, this is the wrong thing. Somebody I met recently was telling, I never knew maza would cause so much of pre-diabetic state in me. As a kid, nobody educated me. I think it's time now that we educate the next generation.
Really, that really makes a lot of sense. So now we have understood the causes of infertility. So definitely, Ayurvedic doctor like me and an allopathic gynecologist working together, making sure our patient is understood what exactly is the problem he has. We both counseling him together and making sure his lifestyle is tamed according to the best way, so that he can get the solution out of this infertility. That would really make a difference. So now there is always a question. In fact, I get a lot of patients. You also would have got the same question. Now patients don't even know that they are suffering from infertility. They would have got married 5-6 years. They're not even aware. So by the time they are aware, it is already late. They would have reached around 30-35 years. So can you just let the audience know what is the time limit, or when is that they should understand that they should evaluate themselves and make sure that they are not having anything wrong inside their body?
So usually what we tell is, when a couple gets married, the time from when they are trying to conceive, that is more important, because as you know, now people are so career oriented.
Yes.
They plan their families well ahead. They don't want it immediately. So it all matters from when they actually are trying to conceive. And when they are trying to conceive, maybe we can give a time gap of 8 months. So 8 months is the time, or 6 to 8 months is the time when where everything is absolutely normal. They should come up with a pregnancy positive test. If at all it's not happening, then I think it's high time they go and consult the respective doctors for the further evaluation.
Yes. So that they don't delay the process, and by the time they realize it's late.
Yes. And one more thing is, if at all they have got married late, so nowadays late marriages are there. So if you are like 34 plus as a female, definitely I would not recommend to plan next after 3 years. You have to keep 1 or 2 months as a time gap, and try to, if at all you're planning for a family, I think that should be the priority.
See a doctor and get yourself sorted.
Yes.
That's the key. Now we are in the society. I think the stereotype has been little in a changing trend, but still the majority of population till date, if you speak about infertility, it's always targeted on the women. So men are always thought they are always fertile.
Correct.
They have no absolute issues. So if a couple is not conceiving, automatically 90% blame is on the female. So what do you think? How is that to be taken?
So it's not as we were discussing. It's like how much a female contributes. How we need both hands for a clap to be heard. The same way, it's both male and female factor which contributes to a baby. So it's how 50% this side, 50%. That's what the patients fail to recognize, and they absolutely don't even. Some couples don't even come up as a couple for evaluation. Because here we are trying to evaluate one side of the story. What about the other side? It just goes. So I would recommend, whenever you're going for your fertility treatment, always as a couple go and get issues sorted.
I know, in my practice also, I should say, I never treat an infertility patient on one side. I say, if you come as a couple, you're there.
Yes.
Or else it's like you are just
shooting your arrow on a blind space. You never know.
Because if there is a real culprit on the male side, and you are continuously targeting on the female, it doesn't make sense. End of the day, your fame is also lost, and patient is also not getting anything. So that's I would say what you said is a wonderful way of thinking it. So talking about some treatment modalities. So let's keep it both the sides, so that our audience understand what has Ayurveda to give and what has Western medicine to give. If a patient comes to you with an infertility, so routinely you get the investigations on the female side and the male side for the investigations. Once it is done, so what are the things you can do from the medical management point of view in terms of Western medicine for a female and a male?
So initially when they come, we have to evaluate the anatomical factors, as it's a basic thing, whether the uterus or the tubes are patent, the uterus is in a normal shape, are there eggs getting generated, or there are any hormonal issues or PCOD issues. These are the common things which we can be evaluated with an ultrasound as well as some blood tests. So we usually do their reserves, what we call as ovarian reserve, wherein we know that this patient can be given so much of time for some next level of treatment, or it can be done at a grassroots level. So this is a basic evaluation for a female. For a male, we do something called as semen analysis, wherein we check their sperm count, sperm motility, the quality of the sperm, and accordingly we take it forward.
Yes.
If there is any issues in any organic causes or anatomical causes, it has to be addressed then and there before we start the medical treatment. Initially, we go for something called as ovulation induction, wherein we try to give few multivitamins and ovulation induction drugs for a very short course, and added on gonadotropins. There are some injections which can help us give quality eggs and the quantity as well. This is from the female side. If the male factor is present, then of course we do some corrections in their lifestyle, and if the patient is diagnosed to be hypothyroid, hypertensive,
Metabolic disorders.
diabetics is one of the most common causes of a male infertility too. So we address those issues and we give them kind of some coenzymes or multivitamins.
Supplements.
Yeah. So these are the things from medical point of view. This is the first level, or what we call level 1 treatment we can give. So do you have any kind of approach at this level, Dr.
Yes.
Chetan?
So I would say in Ayurveda, especially in Praanavaidya, if we get a patient, we always think in this point that we try to figure out if it is an anatomical problem or a functional problem, because the whole treatment approach differs. If it's an anatomical problem, it differs if it's a functional problem. In my years of experience, and I've heard from my seniors of Ayurvedic practice, I say Ayurveda can do a lot of things for your functional correction, but if it's an anatomical correction, definitely I'm referring it to you, because let's understand the functional correction. As you rightly said, there is a lot of impact of their lifestyle. So in Ayurveda, we do something called Panchakarma, which is basically a metabolic correction. So all my patients, I make them understand. Now you drive a car for 10,000 kilometers, you definitely have to service it. So now 25 years you have driven your car like crazy. Like, you know how crazy you have driven your car 25 years. So it's a procedure of servicing your whole body. We do 4 days of snehana, then massages, loose motion. We make sure your toxins are removed. If in a Western language, if I have to tell it, it's basically we are reducing the free radicals or reducing the oxidation reaction, which is basically all the other enzymes trying to do. So your overall health improves and your fertility factor improves. That is for the male as well as for the female. For females who have a less ovarian reserve or egg reserves are less, we do this Virechana. Post that we give Ayurvedic supplements. See, the best advantage is Ayurveda in Indian public is known for this. People know Ayurveda for sexual medicine and infertility, because the phytochemicals what we get from our herbs is known to generate a lot of hormones which will help in your fertility factor. So in terms of functional correction, yes, Ayurveda definitely has an upper role. But if it comes about the structural problem, now if you get a patient, we do Virechana, we do a course of Rasayana, we make their functional problems correct. Now then we realize, or first only we definitely know there are functional problems, along with that they have structural problem. So I correct the functional thing, I refer them to a allopathic gynecologist, so that if the 2 tubes are blocked, I definitely know nothing is going to do. The maximum thing I can do is I do something called Uttarabasti, where we give medicated ghee into the uterine cavity, which heals your uterine endometrium and the mucus. So next time, but I definitely know the sperms can't enter the tube. So we have to have that rationality. So if I refer it to you, after I do the Uttarabasti, you can plan for an IVF. And the interesting part is, based on the research is done, in IVF which is done after an Uttarabasti, the success rate is 30% more. Now you tell a normal IVF, the success rate is around 50-50. By your permission, I am just quoting your number.
Yeah, so whoever tells IVF has a success rate of more than 80% is not true, because any procedure, say it Ayurveda or Allopathy, has their own restrictions.
Definitely.
So, but definitely, it's, if indicated, it has a higher success rate for a couple than undergoing an IUI, which is much lesser compared to IVF.
Okay, so for the structural problems, definitely after I would take it as a glimpse in this way. Now a patient comes to Praanavaidya, we have their evaluation, we see the functional problems, we correct them through Ayurveda. Then for the structural problems, we send them. If some people only functional problem, they get cured here, they have normal pregnancy. But there are cases where they have structural problem, we route them to Dr. Namratha or a team who can handle them. Either you go for an IUI or you go for an IVF, with which the success rate is high. high, and rather than you going and getting IVF done anywhere else where your success rate is still questionable, you do it here, you get a very good result. That's what is integrated medicine supposed to do. For my viewers' knowledge, can you just let us know what is IUI and what is IVF basically?
Yeah, so IUI is called as intrauterine insemination, where male factor is present, that is we have poor count or we have poor motility. We try to take out the semen of the patient from the male part, and we just process, the andrologist so-called process the semen and makes it gives a good sample wherein the motility as well as the quality of sperms improve. And when the lady is ready to have the ovulation, that day the semen is inseminated into her womb directly.
Yeah.
So there are many places wherein a sperm can die. So for example, as in a natural intercourse, it might be the cervical mucus, where the entry of the uterus, there might be a lot of factors which makes the sperm die. So first of all, if the sperm quality or sperm motility is less, it's obvious that it has to travel a long route to meet the egg. So this is something, a shortcut wherein it crosses all these barriers, the natural barriers, and tries to meet the egg as early as possible, and we get a better result in such cases.
Just giving a courier service to this being blunt.
Yeah, maybe something like that.
Yes.
IVF, in the other hand, it's something called as in vitro fertilization, most commonly known as test tube babies. So here what we do is we retrieve maximum number of eggs from the women, and we freeze it. We take the same day, we take the semen of the husband. So under microscope, the eggs are evaluated, and there are different procedures like ICSI or IMSI, wherein the sperm gets penetrated in the ovum under a vision or done by an embryologist. So then we have the embryos. So embryos are again developed into different stages, like stages like a blastocyst and all. And seeing the quality of embryos, the date of the transfer for embryos is decided. Usually nowadays most of us practice the next cycle to transfer these embryos. Then the so-called embryos are transferred to the womb of the lady.
Fantastic. So majority of the audience have understood what are the available options. So when you know there are a lot of treatment options available, there creates a confusion also. Now which one do you select?
Yes.
Do I get an IVF, or do I get an IUI, or do I get lifestyle correction? So if I have to put it in a nutshell, as I told earlier, so it's all about your functional problem. It's that your metabolism is not okay. Your body metabolism is playing games, because of which you are not able to conceive, either by the paternal cause or the maternal cause. I think Ayurveda holds an upper hand. But if it's an anatomical problem, or there is a lot of anatomical issues, that's where definitely surgery or allopathy holds a upper hand. If you
I have a little bit of a different opinion on this. So as you told, functional cause, definitely lifestyle is there, but what happens is, again, as we are dealing with patients who are little elderly or with major hormonal issues, we cannot take kind of long time for these things to settle in. So we cannot give a patient go for a year, do everything and come. That doesn't work out. So that's where you get your lifestyle put in right for the patient. We try to from our side, there are few kind of vitamins or insulin sensitizers we put for, I'm just giving an example, for PCOD patients, wherein both hand in hand have to go. Just doing one form of treatment may not work. It might take longer time, wherein we are losing the time for the patient, and we want to get finally a positive result.
Perfect. This is what is essence of integrated medicine. So the sad irony is that a lot of Ayurvedic doctors, allopathic doctors are not open for this. So probably doctors like you and me who are trying to break the ice someday.
And one more thing I would like to add on, in patients with endometriosis, it is something wherein it eats up the quality. So what do you have any particular kind of timeline, or you have some structured treatment for these kind of cases?
See, we basically focus in a way that what Ayurveda believes is we have to start correcting your basic levels of health. Basic levels of health includes if a patient has infertility, that definitely understands that either she is obese or has hair fall or a lot of other problems. So we correct one major metabolic lifestyle, along with that everything gets settled. But if you're asking in specific diseases like endometriosis, which need surgical intervention, I will be the first Ayurvedic doctor to directly refer it. See, as you rightly pointed out, it's better than delaying your patient and giving a try. When you know there is a right answer for that question, you shouldn't scribble around and make sure the question is also made wrong. No? So I would definitely refer it to you so that you operate on the patient and make sure the patient is pain free, rather than me trying to impose Ayurveda, and after 6 months or a year when time is also then me referring to you will not fetch anything to you as well as not fetch anything to the patient. So that's where all the Ayurvedic doctors are supposed to be educated, is what I feel. And at times when the patient comes to you, now you know patient is just 26 years old, 27 years old, you know it's typically a functional disorder, she has hypothyroid and she has obesity, so that's where you know that just supplementation doesn't work. So if you can refer it to an Ayurvedic doctor right time, we do a panchakarma, we make the functional correction, then we refer back to you. End of the day, who is at benefit?
Both of us and the patient.
Yeah.
Both of us and the patient.
So that's what is the ecosystem what we are trying to do. So I think, yes.
And one more thing is, I think male fertility. Male fertility also, has some integrated approach with benefit. This thing, we cannot create wonders. If the sperm count or motility is very poor, neither allopathy nor Ayurveda doesn't help much. It is only then the patient has to step up to the next level wherein IVF comes into role. But if there are borderline issues wherein it can be really tackled, I think the integrated approach goes along.
I will correct you a bit little.
Okay.
In terms of male infertility, I would say Ayurveda definitely can do a lot of change, because in our experience we have had patients of 35 years old, 38 years old. It's not going to happen overnight. It needs decent 6 months. So 6 months of time you do good virechana. We do something called Uttarabasti, where we give medicines into the prostate, to the urethra, which has the percutaneous absorption and membranous absorption, which over a period of 6 months, who have very bad oligoasthenozoospermia, we have seen them coming to normozoospermia. But it doesn't only come with Ayurveda. It comes with Ayurveda, and you have to do yoga, you have to do lifestyle correction with everything, and supplementation definitely it has a lot of it. But as you said, if I get a patient of azoospermia, there is no sperm at all, that's when I wouldn't say that I would. But there have been research articles where azoospermia also has been corrected, but if it's just a functional cause, if there is a structural cause, for example, a patient has retrograde ejaculation, what will Ayurveda do? It has nothing to do.
So I think our viewers got educated about where to approach, when to approach, and which conditions they have to approach.
Perfect. That's what is the essence of today's podcast. So we are just trying to get authentic words from a speciality, from the doctors who have studied it. Now me sitting and talking about allopathy at one point is not right. You speak about Ayurveda at one point is not right, because it's not our subject expertise. So you bringing your subject expertise, me bringing my subject expertise, sitting together and discussing. Now viewers have got an idea, and we also have got a clarity. How do we really make sure what time the patient has to be referred to you, and you refer me the patient, so that we both working together really bring a difference to this.
Sure.
So I think this has been a eye-opening podcast shoot for us. So I have got a clear-cut idea of what structures, probably what diseases we can deal, and what is the right time for me to refer to you, Dr. Namratha. What is your take on it?
Yeah, definitely. As we were discussing, whom to categorize into which place and whom to direct in the right form and give all of us the benefit of it.
Yes. That was wonderful. So viewers, I hope you have had a fantastic session with us. So you have heard a lot about infertility, you have heard a lot about pregnancy. So expert from another subject of medical science, trying to burst a lot of myths and making sure that you get the best of health, whatever is available in the world. As we always say, this is Praanavaidya, one-stop solution to all your confusion. Thank you.
Thank you.